because of what they've been doing for the past 9 months, have really started to become like doctors. They've learned the medical language. They've had a lot of patient encounters. They've seen that medicine's not all black and white. There's lots of shades in gray, lots of difficult situations, lots of times when it's not a B, C, D, E multiple choice test, that they really have to think through things and pick the best option of a bunch of different good options, or one bad option out of a bunch of pretty bad options. Simulation has a couple of advantages. First of all, there's a clear advantage to having students practice on fake patients before they have to interact with real patients. I think simulation helps with is what's called proprioceptive learning. The idea of proprioceptive learning is that you're learning by having a hands-on experience with something. One of the sessions we did was a central line session, and during that session they're practicing putting central lines in. And as they put the lines in, if they put it in the right place, they get blue fluid back. If they put it in the wrong place, they get red fluid back. And what this really tells them is when they're doing the procedure right, they get this feedback of, oh, okay, blue is good, and so they know exactly what they're doing. That very much helps them know how to move their hands and maneuver through the procedure. And you can do this with all sorts of different kinds of simulation. In the same sense, some of the communication workshops that we've been doing during this session give them some feedback about what communication skills that they're using work. So body language, tone of voice, other nonverbal communication things. They can try to say something like tell a patient that they've got cancer, or that some other bad news is on the way, and they can try doing that in a safe environment, with the goal of being that when they communicate with patients, that they have a real sort of set of skills that they feel confident in, that they're good at when they have to actually break bad news or whatever it is with a patient. We know that adults learn best when they're challenged. They learn best through, in a sense, games, where they have a complex situation and they have to navigate through it. It engages them, it forces them to kind of think. I mean, these are 163 very bright, very motivated people. And if you put a challenge in front of them, they take it on with a real passion and a real sort of vigor.